my name is Johanna Lasher. My classmates and I looked at how homelessness in Evansville can be impacted by occupational therapy and what kinds of barriers these individuals are experiencing.
There is a great need for homelessness support here in the Evansville area. Through this project, we found that there is limited access to shelters and meals and limited affordable housing. Um, the low minimum wage makes it very difficult to find affordable housing here in the area. Throughout this project, we identified two areas that are greatly impacted within the homeless population. The first area is work. The Occupational Therapy Practice Framework, written by AOTA, defines work as labor or exertion related to the development, production, delivery, or management of objects or services. AOTA states that benefits of working can be financial or non financial. Some non financial benefits include social connectedness, daily structure or routine, and contributing to society. Case management for employment and budgeting resources can be two ways to help with the homeless population with work. The Occupational Therapy Practice Framework defines education as activities needed for learning and participating in an educational environment. Education can be formal or informal, formal education being within a classroom setting, and informal education can be obtained through daily activities, just simply learning new skills throughout your daily life. Students who are homeless are typically absent nearly twice as much as housed individuals. Early education programs such as Head Start are good resources for the homeless population to increase school readiness and social skills.
During point in time, outreach teams capture the number of sheltered and unsheltered individuals who are homeless in Evansville on a single winter night. The outreach teams track individuals by family size, age group, veteran status, disability, and more. According to the 2022 point in time, data revealed that 364 people were experiencing homelessness that night, 275 were living in shelters, 42 were living in transitional housing, 38 were living on the streets, 52 were at shelters to get out of the cold, 31 self identified as being a veteran, 177 self identified as having a disabling condition, and 75 self identified as being chronically homeless.
Continuing with more statistics, ethnicity of individuals who are homeless in Evansville include 61% white, 35% African American, 4% Hispanic or Latino, 1% Asian, and 1% Native American. 2022, 14.7% of the population was living with severe housing problems in Vanderburgh County, Indiana. From 2014 to 2022, the indicator declined 1.31%. Of the population, 16.1% live below the poverty line. The largest demographic living in poverty are females aged 25 to 34, followed by females aged 18 to 24, and then females aged 35 to 44. And the most common racial or ethnic group is white.
This needs assessment will inform community members, city officials, and organizations that help individuals who are homeless in Evansville, including the Ozanam Family Shelter, Evansville Rescue Mission, United Caring Services, and more.
For the promotion of health and disease and dysfunction prevention, for the person, education allows a person to develop critical skills like decision making, mental agility, problem solving, and logical thinking. It also enables the individual to build character, opinions, and intellect. For the person, work can provide the person with a purpose and routine. Work also builds self respect, independence, and control over their own life. For a group, education allows classmates to receive mentorship from the teacher as well as each other. Knowledge of new areas can help everyone feel a passion for different topics. This shared interest allows classmates to connect further and provides an avenue for future career options. For the group, work can promote a feeling of social connectedness and well being with coworkers. For the population, education for homeless population can increase readiness for employment and allow everyone to make connections with others from the community. This opens the door for extended opportunities for current and future independence. Work provides everyone with income that can prevent generational poverty among populations. This income will support individuals and families to obtain housing, nutritious food, and other necessities. Increased independence aids in the prevention of dysfunction.
There are a handful of resources in Evansville that help individuals experiencing homelessness. The Ozanam Family Shelter offers shelter, food, some clothing, hygiene products. They have a washer and dryer on site with detergent provided and case management. Evansville Rescue Mission offers food, emergency shelter, a thrift store, and a purpose, accountability, Christ education, and service program that has 3 tracks to choose from, which are overcoming addictions, spiritual opportunities, and health and wellness. Aora has a homeless outreach team, a rapid rehousing program, and community development for advocacy, research, and public awareness of homelessness. Potter's Wheel offers parenting classes, employment assistance, have a paving access to hope and success program, which helps adults acquire and develop skills for employment to improve financial stability and money management skills. Potter's Wheel has a clothing bank and they offer breakfast and lunch once a week. House of Bread and Peace provides food and shelter for single women with children. Programs available are to develop self sufficiency, build independence, and build foundational skills.
For this project, we interviewed Larry Cornett, who is an executive director at the Ozanam Family Shelter.
The questions that we asked at the Ozanam shelter helped us to better understand the homeless population and the problems that they face, specifically in Evansville. We wanted to know how many people are homeless and what qualifies a person as being homeless. We were interested in what services Ozanam provides for these individuals or what services other shelters provide. We wanted to know what barriers there were to helping more people or providing more assistance to those that they are able to take in. We wanted to know what goals Ozanam has and what services they wish to provide that they currently are not. We wanted to know how long people typically use these services for and how all of the funding works. Many people are unsure of the services that an occupational therapist can provide, so we offered an explanation of how occupational therapy could help aid the homeless population. We described how occupational therapy takes a holistic approach when working with clients to provide independence and quality of life. We focused on being client centered and occupation based by addressing the 9 occupations of daily living, which include activities of daily living, instrumental activities of daily living, play, work, education, rest, sleep, and health management, leisure activities, and social participation. The occupational therapy role within the homeless population can include providing advocacy, we can provide direct intervention, and we can even work with consulting services. Being homeless directly impacts several activities of daily living, such as work, education, rest, and health management. We hoped to learn more about the homeless population in Evansville so that we could better understand how we needed to help address their direct needs. Some systems and structures that directly impact the homeless population are the regulations surrounding temporary emergency shelter regulations, meaning that these individuals are not allowed to stay in anything classified as an emergency shelter for more than 90 days a year. There is an extension process, but sometimes it can take a little while to get through it. And by that time, rooms may be gone or other plans may have need to be made. Another is the Indiana Code 313632, which states that emergency shelters can provide shelter, services, or items related to shelter to minors without the consent, notification, or permission from the parent or guardian. A loose background check is also done at Ozanam looking for violence. They also check for sexual offenders. Since this is a family shelter and they have children and women a lot of the times, they do not want anyone in the shelter who has a history of domestic abuse or sexual related crimes. Lastly, we have the McKinney-Vento Homelessness Assistance Act, and this is in each state, and it allows educational agencies to ensure that children who experience homelessness have equal access to the same free, appropriate public education, because homelessness should not be a sufficient reason to separate these students from the school setting. Based on our interview, we learned that homelessness has been a long and complicated problem in Evansville. The last point in time count, as of when we did our interview, had found 527 Category 1 homeless people in Evansville. The Evansville area does not have enough low income housing, the homeless shelters historically have not been the best, and there are nearly no family shelters available. The primary barrier that our stakeholder identified for the homeless was childcare, transportation, and generational poverty. Ozanam Shelter is a temporary emergency shelter with 18 rooms to accommodate families for a short time, hopefully leaving them with long term stability. They also provide 3 meals a day with 2 snacks.
Some more points from the stakeholder interview summary are that more services are needed in the area. The city of Evansville doesn't have enough inexpensive low income housing, and there is only so much volunteer time can accomplish when there isn't enough housing. When they are full at the shelter, they also give advice on where to go, such as the House of Bread and Peace and the YMCA. But for men with kids, there are no other options for housing. And they also may have to end up relying on family and friends. Addressing homelessness in Evansville could help individuals sustain residence in affordable housing, decrease food insecurity, increase availability at emergency shelters, increase employment, and more. One of the greatest needs mentioned in the interview is that Evansville does not have enough inexpensive low income housing. This may be a good place to start, as Larry mentioned, that having a home fosters success in other areas of life. Our stakeholder mentioned that they give advice and connect individuals to resources when they can. So, specifically, an occupational therapist could support the efforts of the organization by providing individualized intervention and advocacy while further connecting clients to local resources. An additional takeaway from the interview is permanency. There are many frequent flyers at the emergency shelter, and they are hoping to hire a second case manager to support the families that are transitioning out of homelessness. This is also a significant consideration for OT practitioners for future practice, as we could aid in developing life skills while focusing on work, education, money management, rest and sleep, leisure, social participation, well being, and more to promote permanency.
These next few slides provide evidence on how homelessness can impact different aspects of life. The first article is a case series that discusses health disparities. This case series presents 3 case histories of homeless patients seen by a homeless team in Western Australia. The purpose is to illustrate the intertwined myriad of social determinants that underlie the frequency hospital presentations of people who are living on the streets. Research from around the world continues to show a strong association between homelessness and health disparity. The authors of the case series identified 3 important lessons from their research. Number 1, homelessness needs to be addressed as a combined medical and social issue. Number 2, our society spends an extraordinary amount of money on health care for homeless people. And number 3, prevailing social determinants and high rates of hospitalization is not uncommon for this population group. The authors conclude that the enormous costs of hospital care can be reduced when housing and social determinants are taken into account.
This article covers life skill development. It is a systematic review. Level of evidence is 3A with a strength rating of moderate. 11 studies were included to capture the range and quality of OT intervention focused on supporting the transition from homelessness. The study noted that life skill maintenance and development, as well as engagement in meaningful activity, helped individuals thrive following homelessness. The research also concluded that research evaluating OT interventions supporting the transition to housing is in an early stage of development. Research could identify associations between engagement and meaningful activity and psychosocial well-being, as well as beneficial intervention techniques.
The most interesting article that I found discussed how homelessness can affect education. This systematic review of 14 studies looked at how homelessness impacts school readiness and academic performance in early elementary school. The participants included in these studies ranged from preschool to third grade. This study found a risk for low academic performance and negative impact on a young children's school readiness and early academic skills related to homelessness. Future researchers may look at how Head Start programs or other early education programs can help children who experience homelessness with social skills and school readiness skills. Ozanam is a family shelter, so they do aim to help the homeless population with children, and these children are more likely to miss school and fall behind.
An article I found was about food insecurity. It was a systematic review. 24 articles met the inclusion criteria, focusing on the experiences of food security during and following homelessness. Participants described experiences when they had to rely on services, including food banks and shelters, as having limited food choices, leaving them to make unhealthy food options. In order to obtain food, participants noted they would go against their morals and beg for food, trade their services for food, or steal. Challenges to meet food needs included lack of affordable transportation, limited kitchen facilities, and a lack of affordable grocery stores that offered healthy food items. Future research is needed to examine interventions to support food security and the impact food security has on well-being.
So the article I found was a mixed methods survey regarding sleep that included 32 participants experiencing homelessness aged 18 to 65 who were recruited from a local homelessness organization in a mid-sized Midwestern city. 2 self-reported standardized quantitative assessments and a mixed method web-based survey were used. In this study, they found that the average number of hours of sleep each night was 5.29, and when participants were asked how sleep impacts their ability to do things during the day, 75% reported sometimes, a lot of the time, or all of the time. There was 4 themes that were developed from the qualitative data on sleep barriers, supports, and impacts. These 4 themes include a lack of environmental control, emotion and thought, substance abuse to substance use to sleep aid, and sleep is important for health and daily function. More research is needed to increase the intention and resources towards sleep quality and quantity within this population. Our solution to help the homelessness population in Evansville is to add an occupational therapist to the team at shelters to help individuals develop a plan for work by making a resume, finding their strengths and weaknesses, and finding job fairs. We can aid in money management, develop a routine, offer resources for low income individuals related to food, clothing, medication, hygiene products, childcare, and more, And we can also advocate for this population by going with them to doctor office visits or more.
There are many professionals that could provide benefits for the homeless population. As mentioned on the last slide with our solution, an occupational therapist can be a great resource for this population. Occupational therapists can provide trauma-informed care, as well as helping individuals prepare for work, education, and provide them resources to best help the individual. Social workers can provide resources for financial aid, and physicians can help with medication management and disease prevention.
Here is just some examples of goals that occupational therapists could help the homeless population work towards, whether that be an individual experiencing homelessness, a group of people, or even the homeless population as a whole. For individuals, we could help identify personal strengths and weaknesses that are related to job related skills and help them come up with a resume. We could also help them work on money management as well. For the group population, we could work on goal setting and job interview skills, and we could have mock interview groups until they are able to obtain a job, and we could help increase their confidence and the skills needed for those jobs. And then for a population, we could create a showcase of resumes with their personal skills and strengths that are needed to increase independence. And we could also host job fairs for these individuals as well. These are our references.